Hello everyone. My name is Carrie Loy and I'm your MC for the event today. I would like to welcome all of you to the RBC Convention Center. I'm fortunate to be one of the site coordinators here at this location, and I'm also one of the regional managers here at the Vaccine Implementation Task Force. Besides that, I'm also a community licensed pharmacist, and I am very much looking forward to providing the Pfizer Comirnaty vaccine to a child here today, and we'll get to that part later on our event after the speeches. It is my pleasure to introduce our honored guests. We have Minister Audrey Gordon, Minister of Health and Seniors Care, Dr. Joss Reimer, Medical Lead on the province's Vaccine Implementation Task Force, and Dr. Jared Bullard, Pediatrician at the Children's Hospital and father to Donovan, one of the children who will be immunized here today. I would also like to welcome all of the families here today, the parents, the kids, and their loved ones who came along. Thank you. Thank you for taking time out of your busy lives to be included in this important moment in Manitoba's history. As we immunize the first children in the 5 to 11 groups against COVID-19, it is very exciting. I would also like to thank all of you, media, for covering this event today and for sharing important public health information throughout the Protect MB campaign. We appreciate you being here. It is my pleasure to now welcome Minister Gordon to the microphone to bring her remarks. Minister Gordon.
Thank you, Carrie, and good afternoon, everyone. It's such a pleasure to be with you all today, and I'm so pleased to see all the happy faces and all the families. Thank you for joining us. This is a very special day. Our government is pleased to announce that the Protect Manitoba Kids campaign is underway, and children aged 5 to 11 are starting to get immunized against COVID-19 here in Manitoba. I know that Manitoba parents have been waiting for this day to come, for Health Canada to finish the clinical review process prior to their approval of the pediatric version of the Pfizer vaccine, which took place last week. Our vaccine teams in Manitoba are ready to immunize all children aged 5 to 11 in Manitoba, and I'm grateful that this phase of the campaign will bring about strong protection for kids, families, and for all our communities. Vaccination is a normal part of childhood, and I know that the children joining us today have also received other vaccines before today. This vaccine protects those who face the highest risk of serious illness, even hospitalization or death, if they were to get sick with COVID-19. Kids, I hope you feel very proud of yourselves for taking good care of your health and for protecting others. You are brave and you're smart leaders, and that's why you're here today. The feeling of knowing you did your part to protect everyone around you is a great feeling, and it will last for as long after today's immunization. I would like to thank everyone involved in the Protect Manitoba Kids campaign for doing your part in this monumental effort. Whether you are a parent or guardian, a child, a pediatrician, a pharmacist, immunizer, or someone working hard at the call center to help Manitobans by booking thousands of appointments, we appreciate you all very much. For all the families here today, thank you again for sharing your time and your stories. Parents, thank you for helping to prepare your children by talking about vaccination and for sharing with them your confidence in the safety and effectiveness of the vaccine. I hope that you will continue this spirit of celebration after you leave the super site today by enjoying a treat or doing something special as a family, and especially by telling your friends that you got immunized today. When we tell our friends and loved ones that we are vaccinated, it helps others feel good about making the same decision. Kids, when you get your special stickers today, and I've seen them a few times, so you will enjoy seeing them too. You can show them to your friends, and I bet they'll want to get one too. As more and more Manitobans get vaccinated, we will all become safer at work, at school, and at all the places we like to visit. And when the pandemic is over, and I'm sure it will be one day very soon, I know that I will look back on this day as one of the most important ones in the campaign. As parents, there is nothing we want more in life than to know that our kids are safe and protected from harm. I'm grateful we now have a vaccine for kids, and this day is finally here. I would now like to introduce Dr. Joss Reimer, the medical lead on the province's Vaccination Implementation Task Force. Dr. Reimer, thank you so very much for all that you've been doing for Manitoba families and for our children. Thank you for always bringing us timely information. I enjoy sitting at the press conferences with you and having discussions offline as well, and it really helps everyone to make good choices. So thank you very, very much. I'll now turn it over to you for comments.
Thank you so much for those kind words, Minister Gordon. Like Minister Gordon and all of you, I am really excited to be here today. I celebrate the hope and the optimism that this day brings. The wait for Health Canada's approval for the pediatric Pfizer Comirnaty vaccine felt long, and it felt long especially for parents. It must have been so stressful to wait. The wait, however, was essential to ensure that no steps would be missed in the clinical evaluation and review process. It is incredibly heartening to know that the pediatric vaccine was so thoroughly tested and reviewed. This gives us even more confidence in the final determination that based on all the evidence available to Health Canada, the vaccine is safe and effective for children in this age group. Aside from the work I do on the vaccine task force, in my clinical practice, I see and meet with many families, and they have many questions around vaccines, and it's so important to make time for those questions and to answer them carefully. Every parent wants to do what's best for their child. The challenge is sometimes it's hard to know what's best. In the case of the Pfizer pediatric vaccine, fortunately, it's not as hard to know what's best. We have a lot of evidence. We have the science telling us, we have the research telling us, information that has been proven without significant doubt. I know that the parents joining us today with their kids have done their homework on this vaccine. If you have yet to book an appointment for your child to be vaccinated, I encourage you to visit protectmb.ca for up-to-date information, answers to frequently asked questions, and resources for both parents and for kids. Your primary care provider, your pediatrician, as well as your community pharmacists are also great resources. One of the things that has been the most successful in the provincial COVID-19 vaccine campaign is how broadly the vaccine is being made available across the province. You can visit a provincial vaccine clinic like this one. You can visit an urban Indigenous community clinic, a pop-up, your doctor's office, a local pharmacy, and we have all of that information on our Vaccine Finder map online. So you can look on the website to see all of the hundreds of locations that are available and ready to serve you. I want to thank everyone for being here today. I'm so glad to be here. We celebrate the children's vaccinations as though they were our own, because really, I think everyone on the task force feels that we're in this together, and this is a big moment for all of us. I'd like to introduce my friend, Dr. Jared Bullard. I've had the privilege of working with Dr. Bullard for, I think, 10 years now, and I'm so happy to see him along with his son here today. He's a pediatrician at Children's Hospital and a great dad, too. So welcome, Dr. Bullard.
All right, thank you very much, Dr. Reimer. Those are very kind words. And of course, we have all these kids in the room. Are you guys excited? Yeah, a little bit nervous too, I bet, right? And it's okay, that's okay, right? So, I'm happy I could be here today with my son to get the vaccine. It's something that as a parent and as a pediatrician we've been talking about for a very long time. And so now that Health Canada has finally approved it, it really speaks volumes to the efforts made by everybody to make this happen. Donovan, like a lot of kids, is not the biggest fan of needles. Unlike other vaccines, he's already had the advantage of seeing most people in his family go ahead and get the vaccination. So his sister, who is 14, went, and of course I have to give congratulations to that whole age group, because their altruism and community responsibility has been commendable. He's also seen his uncles, his aunts, his parents all get the vaccine, and so he's very excited to be able to do that today as well. As an infectious disease doctor, I have had my fair share of needles, and I can tell you, and I have reassured Donovan as well, that this particular vaccine is far less painful than the other ones. At best, it's really a squeeze or maybe a pinch. Some kids have actually said that you're done, this has actually been done to me already, and they really don't even feel the needle. Parents who have had the COVID vaccine probably appreciate that as well, that it's a vaccine that is really quite mild. But regardless, it's still important to prepare your children in advance. Talk to them. Parents know what is best for their children, and in general, I suggest maybe a day or two of notice. Talk with them about the vaccine and let them ask questions. Also, prepare ahead of time and be ready to distract them while they get the vaccine administered. Often pediatricians will talk to kids and ask them all sorts of questions about their stuffy or their favorite pet animal, and that might work. But other kids, it actually might work better to simply have a story told by their parents or to simply look at their iPhone. Whatever works. Asking for help if you need is also a great idea. There's a number of healthcare professionals in pediatrics and child health who are more than able to answer your questions. Many family doctors also can talk about things that are available. Some children, you like the numbing cream that can be prescribed in advance. That doesn't necessarily take away the anxiety of getting the shot, but it's helpful, and it can be psychologically reassuring for them. Many parents worry about the side effects, and first and foremost, I've had a lot of time to think about this virus and this vaccine and review all the evidence, and I believe it is safe, like Dr. Reimer said. Based on studies done, we've seen that there are very few side effects. Fever and headaches are less likely in children, whereas redness at the injection site is a bit more likely. So plan for a low-key day for today after the shots. That will make it an extra special thing too. I also appreciate that for a lot of parents, this is an anxiety-provoking event. Some, this will relieve their anxiety, while others, it'll actually increase it. We know that many parents are eager to get their children vaccinated from COVID, while others have a more wait-and-see approach. To those parents who are waiting to see, I offer this advice. Take your time, think about it, but have very specific criteria that you want to use, whether that's a certain number of children vaccinated, it could be in a certain timeline, and feel free to always ask your physician or healthcare provider about the COVID vaccine. We also know that it's important to consider your own child's perspective and risks. So if they have medical conditions like a lowered immune system, they have neurological differences, if they're obese, the chances of them getting COVID and getting sick from that particular disease is higher. Canada has the benefit of seeing real-world examples of vaccine's effectiveness in children. Over 1 million children ages 5 to 11 in the US have been vaccinated to this point, and we've seen over 2 million children, older children vaccinated in that age group. Though there have been exceedingly rare safety concerns in 12 to 17-year-olds, specifically around perimyocarditis, all of those children typically have very mild symptoms and they fully recover. I would encourage those. We're fortunate not now to be able to get the COVID vaccine in a variety of places. You've already heard that you can get it at your doctor's office, at a pharmacy, you can get it here at the super site, and all of those are really good options. When I talked to Donovan about what he's looking forward to most today about getting the vaccine, the first thing that came to mind was he can go to restaurants with his friends and get back to playing hockey without interruption. I imagine all of our kids are waiting to get back to more normal routines, and I encourage parents to book their appointments as soon as they can. Thank you for listening, and I think Carrie now has something special for us.
Thank you for that, Dr. Bullard. I definitely will be utilizing those tips as I'm planned for vaccination for my 2 girls. We appreciate all of our speakers for their thoughtful remarks and for the great information being shared with Manitoba parents, caregivers, and children. Since we're all here to celebrate the launch of the Protect MB Kids campaign together, we thought we shared a kid-friendly video that's all about vaccination, asking questions and making good choices, even if it's a little uncomfortable sometimes. Shared Health has produced this video that we're about to watch with another great pediatrician, Dr. William Lee, and his adorable friend. So please enjoy.
Hi everyone, my name is Will, and I'm a kids doctor. I work with kids all day long, some who are sick and need some medicine, and others who are well and need a vaccine to help prevent them from getting sick. Today, we're going to be talking about the COVID vaccine. I want to answer some of your questions and give you an idea of what it will be like to get the vaccine. I'm also here with my friend No Name, who is going to help give us some tips to make your vaccination appointment a bit easier. So let's get started. You might receive your vaccine at your doctor's office, like the one we're in right now, or at a pharmacy if you're over 7 years old, or you could get it at school with your friends. Depending on your age, you might have a parent or another adult with you, or you might be with your friends and teachers at school. No matter where you get vaccinated, you need to know that we will take good care of you, make it as quick and easy as possible, and answer any questions you may have. Vaccines come in a needle, like this one. You might not like needles, nobody does, and you might be a bit scared. That's okay.
You can take a stuffed animal or another comfort item to your appointment.
Your immunizer will get you settled. They will clean your arm. It might feel a bit cold and wet.
Wear a short-sleeved shirt. Tell your doctor or nurse which arm you want them to use and hold your stuffy in the other.
They may ask you to look away, count down, or tell a story while you are getting the vaccine.
Keep your arm jiggly like a piece of spaghetti while you wait. But when it's time, remember to take a big belly breath and sit really still.
After you get your vaccine, you'll get a Band-Aid and a sticker. You will have to hang out with us for about 15 minutes.
Bring a book or something to do for the 15-minute wait.
If you want, bring an ice pack in your lunch kit and put that on your arm while you wait for the 15 minutes to be up. This will help any discomfort go away. You might have a sore arm for a couple of days, and you might have a headache or feel extra tired. This is all normal, and you should take the chance to rest. Your body is now building up its armor to protect you and everyone you love against the virus. Don't forget that you'll have to do this again in a few weeks. Your second dose of the vaccine will make your armor even stronger against COVID. Thanks everyone for watching.
Wasn't that great? If I was a kid, I would really feel much better after watching that video. And right now, I would like to first just invite all the families and our young participants to come up for a photo opportunity. So please, and Minister Gordon, please join us. So just right up front. And you guys, should we move this?
They move it.
Okay.
They do all of it.
Okay.